My name is Jared Wilkinson, and I'm a pulmonologist in the Division of Advanced Lung Disease and Lung Transplant with the Inova Health System in Falls Church, Virginia. Today I'll be discussing medication management, and specifically, how do we address the side effects of the medications we prescribe? Objectives. By the end of the video, I hope you better understand the range of medications and associated side effects, as well as the options for managing these side effects, and recognize warning signs or reasons to contact your PH treatment team. Let's start with treatment goals. Why do we prescribe these medications? Well, first and foremost, we want to help patients meet whatever individual goals they set for themselves and for their disease management. Our hope is that we can increase your activity level and your functional capacity. Hopefully your breathing's improved and you have a better quality of life. We want to reverse or slow disease progression, minimize treatment burden, and ideally prolong life. The focus of today's video will mostly be on minimizing treatment burden, as other videos will discuss specific treatment modalities and how we approach treatment in pulmonary hypertension. I can't stress enough that treatment is a team effort. At the center of the team is the patient, but it involves a village, caregivers at home, family, friends, parents, siblings, clinical coordinators, the clinic staff, the nurses, the social workers, the providers in the treatment team, and then the specialty pharmacy. Those are the pharmacists and members of the specialty pharmacy who the patient's often in contact with regard to filling or refilling medications. Communication is key. You should know who to contact, both in clinic and with your specialty pharmacy. It is important to report any new or worsening symptoms. Don't wait until the next visit to speak up. We don't want to find out you suffered in silence when there are things we can do to manage or mitigate symptoms. It is important to never abruptly stop therapy unless you're specifically directed to do so by your treatment team. This figure reflects the wide variety of treatments that might be prescribed to you. Along the top, there are 4 categories of medications, all of which open up or dilate blood vessels. Calcium channel blockers are oral medications like amlodipine, diltiazem, nifedipine, and verapamil, which might be used in select cases of pulmonary hypertension. Below that, we have endothelin receptor antagonists, oral agents like ambrisentan, bosentan, and macitentan, which can be used alone or in combination with other treatments. At the top right, we have medications that work in the nitric oxide pathway, sildenafil, tadalafil, riociguat. Again, oral medications which can be used alone or in combination with others. And in the bottom right corner, medications in the prostacyclin pathway. These are the most varied, with oral, intravenous, subcutaneous, and inhalation forms, and may be used in combination, typically with oral agents, to help control symptoms. Along the bottom, we have a novel class of medication working on the activin signaling pathway. This first of its kind medication, sotatercept, specifically works to reduce thickening of blood vessels and has what we call an anti-proliferative effect. I'll start by talking about calcium channel blockers. You may have encountered these in the treatment of high blood pressure or hypertension, but when used in pulmonary hypertension, they're typically used at much higher doses. Amlodipine, diltiazem, nifedipine, and verapamil are the most commonly encountered and may have a variety of side effects. Things like flushing, heartburn, swelling of the feet or legs, low blood pressure, and with specific forms, low heart rate may occur. This table reviews not just the side effects, but management strategies. Flushing can often be very uncomfortable or embarrassing. Avoiding hot and humid environments is helpful, as is using circulating air like a portable fan. Heartburn is very common, unfortunately, in many pulmonary hypertension medications. Behavioral choices or behavioral modifications, avoiding trigger foods, can be helpful. These include things like spicy foods or greasy foods, acidic foods, as well as things like caffeine. For those who have significant symptoms overnight, avoiding any meals before bed and sleeping on an incline can reduce some of the overnight reflux symptoms. And in a lot of cases, antacids, over-the-counter or prescription medications, can be used to either prevent or reduce symptom burden, things like famotidine, omeprazole, and pantoprazole. Foot or leg swelling, things as simple as elevating the legs or trialing compression stockings can be useful, but it's important to mention this to your treatment team, as this can also reflect increased fluid retention and may require adjustment of your diuretics. Finally, dizziness and low blood pressure. Low blood pressure is a side effect commonly encountered with many pulmonary hypertension medications. These dilate blood vessels in your lungs, but they can also dilate blood vessels in the rest of your body. It's important if you experience this to 1, alert your treatment team, as you may require adjustment of your medications, but be cautious when getting up from a seated or flat position. Do so slowly and carefully. And finally, low heart rate. This is a side effect of specific calcium channel blockers, but if you notice this, please alert your treatment team, as adjustment of the dosage may be required. Endothelin receptor antagonists. These are oral agents that are commonly used in pulmonary hypertension and include ambrisentan, bosentan, and macitentan. They have many similar side effects to calcium channel blockers, such as flushing, heartburn, and leg or foot swelling. Patients may also develop things like headaches and nasal congestion. And with bosentan specifically, there is a risk of liver toxicity, and your provider may check both liver function and blood counts while on these medications. This table again summarizes common side effects and management strategies. Like with calcium channel blockers, flushing can be embarrassing or uncomfortable, and avoiding hot and humid environments or use of a fan is helpful. Birth defects are a risk for any woman of childbearing age. It's important that all such patients be on effective contraception and contact their providers immediately if they become pregnant or suspect they are pregnant. Fluid retention, which may be seen in the form of foot or leg swelling, is not uncommon, and it's important to mention this to your treatment team, as it might require, again, adjustment of your diuretics or potentially adjustment of the medication itself. As with calcium channel blockers, heartburn is common, and avoiding things like trigger foods, and for patients with predominantly overnight symptoms, avoiding eating prior to bed or sleeping on an incline can be useful. And again, antacids like famotidine, omeprazole, and pantoprazole can reduce or eliminate symptoms. Headaches can be treated with acetaminophen, commonly called Tylenol. Avoidance of NSAIDs like ibuprofen or naproxen, Motrin or Aleve respectively, are important as these medications may worsen fluid retention. Caffeine in moderation can also be helpful, but high doses of caffeine can cause abnormal heart rhythms, and sudden cessation of caffeine use may result in rebound headaches. And ice compresses are often helpful in reducing the frequency or the severity of headaches. Finally, nasal or sinus congestion are common, and things as simple as sinus or nasal sprays may be useful in alleviating these symptoms. The nitric oxide pathway. Nitric oxide is a molecule that relaxes muscle, including muscles and the walls of the blood vessels of the lung and the systemic vasculature. Medications like sildenafil, tadalafil, and riociguat are oral agents that work using this mechanism of action. Common side effects include dizziness, which can be a sign of low blood pressure, flushing, headaches, heartburn, muscle pain, and in rare cases, vision or hearing changes may occur with sildenafil and tadalafil. Like the endothelin receptor antagonists, riociguat is a known teratogen and may cause harm to an unborn fetus. This table again summarizes side effects in the nitric oxide pathway and management strategies. With dizziness and low blood pressure, it's important to get up slowly from a seated or flat position and alert providers if this is a common occurrence, as adjustment of the dosage of this or other medications might be necessary. Because these medications increase the levels of nitric oxide in the blood, it's also critical that patients not take concurrently with nitrates, such as nitroglycerin, and you should alert all healthcare providers that you're on these medications. Flushing can be uncomfortable, and avoidance of hot and humid environments is useful, as is the use of free-flowing air, such as with a fan. Like with the other agents we've discussed, heartburn is common, and behavioral interventions, like avoiding trigger foods or using an incline to sleep, can be useful, and antacids like famotidine, omeprazole, and pantoprazole can help reduce or eliminate symptoms. And both muscle pain and headaches can be treated with acetaminophen or Tylenol and ice compresses. Again, avoiding NSAIDs is important as these may lead to increased fluid retention. And with headaches, caffeine in moderation may help reduce the frequency or severity of these episodes, but high doses or sudden withdrawal can cause rebound headaches and palpitations. A note on specific side effects of these agents: riociguat itself might slightly increase the risk of bleeding. Things like nosebleeds may be encountered. If you see this, alert your treatment team and avoid things like aspirin and NSAIDs, which can increase the risk of bleeding unless specifically directed to take by a healthcare provider. And as mentioned, riociguat can cause birth defects, and so all women of childbearing age should be on effective contraception, and please contact your provider immediately if you become pregnant or suspect you are pregnant. Both tadalafil and sildenafil may cause vision and hearing changes. These are very rare, but if you do encounter this, please reach out to your treatment team. And these agents may also cause erections. When lasting greater than 4 hours, it's important to alert your treatment team or seek medical attention. Finally, the prostacyclin pathway. This is the most diverse group of agents. They can be given orally, intravenously, subcutaneously, or by inhalation. They may have more intense early side effects, which often abate over time. It can be frustrating. Often we feel like it's a tug-of-war battle between the symptoms of pulmonary hypertension and the side effects. But with use of supportive medications and time, side effects often abate and patients can enjoy a very functional and independent lifestyle. This is a list of agents that work through the prostacyclin pathway. Epoprostenol, which can be given intravenously, iloprost, which is given by inhalation, treprostinil, which can be given intravenously or subcutaneously, often called Remodulin, oral treprostinil, called Orenitram, inhaled treprostinil, called Tyvaso, and the oral agent Selexipag, all share overlapping mechanisms of action. They may cause side effects like diarrhea, dizziness or low blood pressure, flushing, headache, jaw pain, nausea, vomiting, and muscle pain or bone pain. And forms given subcutaneously may cause specific site infusion pain, and inhalational formulations may cause cough or throat irritation. This table again summarizes side effects and potential management strategies. With dizziness or low blood pressure, like with other agents, it's important to get up from a seated or flat position slowly and adjust or review medications with your treatment team. With flushing, you can avoid hot and humid environments. For diarrhea, the use of loperamide, also called Imodium, either preventatively or as needed, can reduce the frequency or severity of diarrhea. Again, with heartburn, lifestyle modification or use of antacids is helpful. For nausea and vomiting, anti-nausea medications are commonly prescribed, including ondansetron, prochlorperazine, promethazine, and a scopolamine patch. Eating smaller, more frequent meals can often help alleviate or reduce the symptom burden as well. Headaches can be treated with acetaminophen or Tylenol, and it's important to avoid, again, NSAIDs like ibuprofen, as they risk increasing fluid retention. Ice compresses and caffeine can also be used. For muscle pain and jaw or bone pain, Tylenol is the mainstay of treatment. Ice compresses or warm compresses can be useful. In rare cases, patients may need prescription pain medications, though this is uncommon. Finally, a few words on specific delivery mechanisms. For inhalational treprostinil, cough and throat irritation are commonly encountered. Drinking warm or cold liquids before treatment can help alleviate these symptoms. Viscous foods like peanut butter, yogurt, or honey before treatment can also help reduce the irritation caused by these inhalational therapies. Swishing and spitting after treatment is helpful in reducing coughing spells, and the use of cough drops, over-the-counter cough medications, and specifically phenol-based cough sprays may reduce the frequency of these episodes. In some cases, patients find albuterol inhalers helpful. Finally, with subcutaneous medications, specifically treprostinil, infusion site pain may be encountered. This is most commonly and most severely encountered in the first few days after changing an infusion site, so minimizing the frequency of site changes in coordination with your provider can help reduce the severity or duration of this discomfort. Simple things like Tylenol, cold or warm compresses may be useful. In some cases, prescription pain medications may be necessary, and topical pain medications like lidocaine or aloe vera can be very useful in alleviating this specific side effect. And lastly, the activin signaling pathway. Sotatercept is the only approved agent in this pathway at present. Most common side effects include things like headaches, which again are typically treated with Tylenol or acetaminophen and ice compresses. Your provider should be ordering blood tests regularly to monitor your blood counts, as some patients encounter an elevation in the red blood cell count or low platelets, which might require adjustment or holding of the medication. Nosebleeds or gastrointestinal bleeding are uncommon but may be encountered, and it's important to let your treatment team know if you have these issues. Also, please tell your treatment team if you're on aspirin or other blood thinners, as that may exacerbate these issues. And finally, similar to some of the other medications we described, sotatercept has a harmful effect on the unborn fetus, and so all women of childbearing age should be on effective contraception and must contact their provider immediately if they become pregnant or suspect they are pregnant. Main takeaways from today. The goal of pH therapy is to improve patient well-being. Side effects are common but manageable, and communication is key. And never abruptly stop therapy without consulting your treatment team. Thank you for your time, and please visit phassociation.org for more information.